This session examined the claim that plucking or waxing can increase hair growth in hormonally sensitive areas, and how research, or the lack of it, shapes our understanding.
So you had some good questions come through.
Yes. And so we kind of discussed offline a little bit just to get started with this, but let's go ahead and talk a little bit about what our first, we were submitted a question, and this kind of opens the discussion for something a bit outside of what we normally talk about, because it's not really electrolysis related directly. But so let me read through. It's a little bit on the longer side. And then after that, let's go ahead and discuss. So this was from a listener. I recently came across a post on Electrolysis Information Worldwide inquiring about scientific evidence suggesting that plucking or waxing may stimulate increased hair growth, particularly in hormonally sensitive areas. From experience with clients, I've observed this phenomenon, especially in these areas. However, the studies I have reviewed on this topic were primarily conducted on mice and focused on scarred skin rather than on healthy human skin. I'm reaching out to ask if you're aware of any research conducted specifically on human subjects that provides evidence on whether removing hormonal hairs can indeed stimulate additional growth. If such studies exist, I would be grateful if you'd guide me to them. Additionally, I would welcome the opportunity to discuss this topic further, as it might be beneficial to explore it in an upcoming electrolysis research project. I believe this area has not been researched extensively, and misinformation from proponents of waxing, often labeled as safer method than shaving, continues to affect many people. Mm-hmm. So pretty much what this, let's just to kind of review and sum this up. I don't know, some of you have been in the field a long time. This might actually trigger some memories, but there was a study. There's always the shaving does nothing to the hair, and then other people say shaving stimulates hair growth. Having done electrolysis for so many years, I know that it has somewhat of an effect. And there's kind of like two groups that tend to butt heads on this topic. The research that she's talking about was research that was done on mice, and this was a long time ago. And they plucked these poor little mice, and then they noticed that nothing really happened to the hair. So they decided that shaving doesn't do anything, right? So I don't know if you have, Stephanie, but I don't know about any kind of up-to-date research that kind of disproves that. I have my own feelings about the study done on the little mice, as far as how valid I really think them to be. But as far as that goes, I don't know. So like the first part of the question about do we have new research stating differently? I haven't really seen.
So when we started talking about this earlier, when we were kind of coming up with today's conversation, I started doing a little bit of additional research, and I have it pulled up here, and I have to go through multiple screens. So like when we're back and forth conversing, I'm going to go through the next segment of it. So there are multiple studies that have shown that shaving does not make the hair grow back thicker, darker, or faster. What I'm in the process of going through on these mini research moments is what the name of those studies are, because I want to see the most recent one. I know that I think it was like the 20s or 30s, there was a doctor that had done a study on, 20s or 30s of the 1900s, not...
It's funny that we have to specify now. But
I know, of the 1900s. So there was a study done then, and I'm still struggling to find anything recent. But basically the study stated that simply shaving a hair, cutting it, at the skin surface, when it grows back, it is basically going from that tapered edge to tapered edge, shaved, blunt edge, and then you're getting the thicker part of that hair. And so in theory,
we can all agree on that. That is a proponent to make it appear thicker, for sure.
Absolutely.
In the short term,
That is a texture and visual change.
Yes.
And it's hard once somebody gets into that cycle to get them out of it. Mm-hmm. I don't know about you, but once you have someone who's an avid shaver, if you ask them to stop, or an avid tweezer, and you ask them to stop because we're moving forward with consistent sessions, it takes a little bit of coaxing to get them out of that cycle. And it's
Well, yeah, because it gets like it's the texture. I mean, when they're touching their face, it feels rough now. Bristly, that's the word. It feels bristly, and then it looks thicker. And in order for that to go away, they pretty much would have to go through a full hair growth cycle and let it grow in an anagen back to a tapered edge, you know? So that's difficult for sure.
So I think that that's part of this, is that we have to, when we're asking these questions and we start researching them further, I think that there's a part of it to say, what is currently happening with the case in front of you, right? So, because if the case has no hormone stimulation and that kind of no manual manipulation outside of shaving, then my brain automatically says, okay, so we have to think that there is something happening to stimulate that growth if nothing is happening chemically within the system, right? But that's the first part. When you start thinking about intake on your client's forms, like what is happening behind the scenes? Why am I asking all these questions? Because I'm trying to come down to that. But there is something to this when we were talking about earlier on the cutting into that cortex. Let's, as I pull up the rest of this, let's dive into that portion of it, because I do think that there is something that we're missing. And I want to see if any of those recent happened.
I had brought up the, like, kind of an observational case study, I guess you could say, when it comes to like people shaving. If you were to compare cis female and a cis male, and we're talking about underarm area, and both, let's say the cis male never touched the underarm, which is not uncommon, but the cis female at, you know, starting at like 14 started shaving their underarms. Let's say no waxing, no laser, no nothing else, just trimming, right? Just shaving. I feel like there is a structural difference between both underarms on each individual. And the only difference here is going to be that one has been shaving since beginning of puberty and the other has not. The main difference is I feel like cis females' underarms will tend to be thicker, more spread out, so a larger area, than cis male, which tends to, sure, their hair might be like 2 inches long, but if you notice, it tends to be a little softer around the edges. So the hairs are not quite as thick normally as you would see on most cis females that come through. And one has even more testosterone running through their system than the other. So you can't really say that it's like that they have a hormonal issue or a hormonal whatever, because cis males will have a lot more testosterone free flowing than cis females. We're talking about a hormonal area. It is underarms. And so if the only difference that you're noticing is the fact that one has been shaving since the beginning of puberty and the other one has not, then there has to be something to the fact that the razor does stimulate to a certain extent. My biggest gripe with the whole plucking the mice thing is that the types of hairs that you're plucking out of a mice are deep, thick, terminal hairs. It would be the equivalent, I mean, as me plucking my head hairs and then expecting it to just keep getting bigger and bigger and bigger. The structure of these hairs is about as thick as it's going to get. So it's not like I can make it worse, right? So that's kind of what we had talked about. I mean, you're not really testing the right criteria.
Right.
I feel like it would have to be structural hairs that are like in the vellus or accelerated vellus in a hormonal area. And then once you do that, you see what happens to that hair. Once a hair's terminal, it's terminal. It won't keep getting bigger. It's not like, you know, I kind of joked around, but it's like a hair will eventually kind of max out with how deep and thick and dark it's going to get. It doesn't just keep going with no end in sight. That would be ridiculous. So
you're just one big old hair.
Yeah, right? Just one hair.
Well, I think about like our trichotillomania patients that come in, with enough, like when I say manual manipulation, I'm talking about like, we're talking about tweezing, we're talking about waxing, we're talking about sugaring, and we're talking about threading. That's one method of it. But manual manipulation of that can also be doing home laser or doing home epilators or even dermaplaning, because especially dermaplaning when you are not qualified to provide said service and you think, I'm going to just do it at home because I can get dermaplaning razors off of Amazon McKesson's shop. Like, let's not and say that we definitely didn't. Like, that we don't want to do that. But there, in that manual manipulation, it does change something in the hair. When I was looking up earlier, there was a 2012 British Journal of Dermatology, which was the insights into shaving and its impacts on the skin.
Okay.
So it looks to be the summary in this. It says male grooming has its roots in antiquity. Control and styling of facial hair has invariably required and development and use of metal instrumentation to remove that hair. Once crude and unreliable, it's later become very sophisticated and subject to intense research and development in the highest scientific level. So there most likely is studies, if we think about all those shavers where they put extra blades on the end, to see what we were going to do for that. I think that there's something to the fact that we are seeing within our dermaplaning patients and clients that it's not just changing texture. I think that there is stem cell stimulation in that injury that you're purposely causing to the skin for turnover and rejuvenation. Do I think that it's substantial enough? No, unless there was terminal hair growth there. And that's the big qualifier for me. So I don't really think, like when we were talking about the underarm, and I don't know about you in this one, when you're talking about the difference between a cis female underarm and a cis male underarm, I'm going to take that step further. I truly believe that I have better results behind a laser, especially within my cis female patients and my cis male patients in the genital region. And that is because the density patterns in the underarm and the genitals is much more concentrated for the majority of our assigned female at birth patients than it is for our assigned male at birth patients. And
so it's like absent of all the testosterone being extra, in cis males, like we have to find out what's causing greater density in cis females, because you can't say that it's because of hormone stimulation. And normally that would be our biggest reason. So
and then there's another part of that, because when you were talking about this in the PCOS world, there is conversations about the fact that when someone assigned female birth goes through puberty, they tend to go through puberty earlier than their male counterparts. Okay. But that shift into puberty is a surge in the sex hormones that are there, and they're very androgen sensitive. Okay. So very testosterone driven. So it looks as though those assigned female at birth might have a bigger burst of testosterone quickly to establish that and give that bulk very quickly, where the assigned male at birth counterpart has a gradual increase and testosterone peaks at a later time. Okay, so by the time their underarm hair would get bad, it's their testosterone's already starting to drop down, and it never gained enough to encourage them to have permanent hair removal in those areas or laser hair removal, because it was never thick. It was never problematic for them. But for the assigned female birth patients, absolutely, we are seeing that. And I think that has, like, when you were talking about that, I think there's a foundation to that is more along the lines of when someone starts puberty, how soon and how quickly did changes happen? Because when I think about like child that is, say 12 years old, starting puberty, assigned female at birth, and a child that's male, assigned male at birth, theirs normally doesn't really kick off until they hit freshman year.
Yeah.
Where right now we're seeing
like
most
14,
of
15 even.
14, 15. And right now we are seeing like the assigned female at birth patients getting their menses as early as like 10, 9 years old. And so our bodies are heavily impacted in these spaces. And I do think that there is something that when we start shaving, because society doesn't think it's okay for someone assigned female or some of them presenting to have hair. We're supposed to be little naked mole rats. That's like what we're supposed to do. Mammals are not. And so we're managing it very early. And there's something happening during that time that is shifting it. And I do think that's the part that we haven't studied enough yet. Because if they're studying assigned male birth beards for a razor, which is wild because they use it for their face, study the razors for my body, because that thing is like, it's putting in the work before I had hair removal done, over more landscape. So I would love to be able to see what that would do, studying all of those other body areas that we just discussed, because I think that there is something there. So that's my take on that. When I'm going to drop this link in the chat because I think that it's kind of cool to read through these and go into a much deeper dive. And if you enjoy nerding out on scientific studies like Giovanni and I do, it is pretty cool to save this to your device. And then there's another one in here. So later on, I have to go back into those links. But if you want to continue by bringing up other topics, I can.
Sure.
I'll go back and forth.
This episode is sponsored by Aesthetic Systems USA, distributors for advanced aesthetics and electrolysis equipment. With a focus on technology, training, and client support, Aesthetic Systems partners with professionals to deliver safe and effective permanent hair removal solutions. Explore their offerings at aestheticsystems.com.
Let me go back to the question just to make sure that we kind of... So, I mean, as far as like anything more recent that kind of talks about stimulation via plucking or waxing, I don't know that I've seen anything recent. And if anybody has, please send it over our way. It'd be great to see. I feel like the closest that we get to seeing something like this, where the phenomenon kind of happens, is paradoxical hypertrichosis, really. And that's laser caused. But if we can say that, let's say we can test it on waxing and shaving and see if those two types of modalities also cause paradoxical hypertrichosis, it might, that would think that would be a pretty valid experiment to do at some point, because I feel like it does within certain restrictive guidelines. I don't feel like you shaving your forehead or dermaplaning your forehead will magically grow terminal hairs on your head. Because the hair structures there are not the types to stimulate unless there's some sort of issue. But
those hairs
shaving under here is a different story. What was that?
Those hairs are very easy to kill. Yeah.
So that's why dermaplaning, I mean, for the most part, if they're just kind of dermaplaning around this area here, I don't like it. I'm not a fan of dermaplaning. I know that, plenty of people do it and they swear by it and it's for the peach fuzz and all this and that. I'm not a super fan of it. I don't think you are either. I just don't like people shaving their faces, but that's really what it comes down to.
If you're already shaving, when somebody listens to this later on, if you're already shaving and you're starting your journey with electrolysis, I understand the need to continue.
Of course.
100%, especially with how it makes somebody feel. That being said, if we can postpone that until you don't have hairs and you can see me a little bit more frequently, that will take the pain away of having to grow the hair, as well as help us expedite your process, get you to a control phase faster.
Anytime I have a client that dermaplanes, my biggest comment is like, isn't your goal in the future to not do anything on your face? Like, isn't that, if that's the goal, then let's work towards that. There's a lot that you can do with electrolysis, thick and small. And so ideally, I mean, you're undertaking electrolysis so that you can be free of everything, like no laser, no waxing, no threading, no shaving, no nothing, just live your life with no issues, hair related at least.
Okay, so this is the other part of the study, and I'm going to be dropping this into the chat here momentarily. So this is where that I'm a little bit like, where's the studies on women? So the Smithsonian Magazine, which is where I'm going to be dropping this in, had a 2015 study in regards to, does pulling out your hair help reverse baldness? So once again, instead of us looking at a shaver for the person who uses it for the most area of our body, or tweezing, when people tweeze their hairs, usually more, and those assigned female or femme presenting, they are studying on men. So fun stuff. But it does say that in this one, it talks about like the implications of regenerating tissue or even like battling like cancers in this space is we're looking at what that stem cell can do in this space. So it is, as I read through, once again, it is tested. The surrounding tests were done on rats, not mice this time. Another little
I
rodent.
think it's a bummer. I don't like it.
I know. I'm like,
Getting
leave
plucked.
the poor cats alone.
I'm sure there's plenty of humans that will be okay with you plucking them. I don't understand why do we need to go torture animals? But
I feel like
anyway.
every nail salon out there that does tweezing and waxing would just willingly be like, yeah, sure, here's enjoy.
Yeah.
But so this other study does talk about that more. I will say that Smithsonian Magazine, they really want you to subscribe. And so the amount of pop-ups, I have not gotten to read far enough in here without having to cancel out one other pop-up. Okay. So just have your pop-up thing on your computer, situated that you're not having to do what I'm doing on my phone as we're talking about this. But 2015, so there are, recent-ish studies when we think about this. I would love to be able to see them done on people who are actively asking us to remove hair at large sums, not to stimulate growth for reversing baldness, because, well, yeah, and I tell my patients this all the time. If you are someone that has experienced balding and you shave your head, this is what we're trying to do. We're just gonna I've given up. We're not gonna go the Picard. We're not gonna have that ring of hair. We're just gonna get rid of it. And so they start shaving. It doesn't stimulate growth in that space. No. It's not all of a sudden that you end up with like more hair because you've been using a Bic razor on your head for the last 10 years. But there is something to it if you have not seen the area wax over in that time frame. You can reverse balding usually until that waxing happens. And that's when we can like really benefit from stuff like minoxidil and Rogaine and the hair stimulating caps and the combs and that kind of stuff to stimulate that in those spaces. But it can't get to the point where it gets waxy because that's basically your follicle's done. It's closed up everything.
Well, yeah, you have to have a follicle in order to affect it. If it's gone, then it's gone, right? That's you're not going to materialize hair follicles out of nowhere unless you're transplanting them physically.
Yeah, exactly. So there's a level of stimulation obviously can be done through like a pulling method or a medication method in these spaces. I cannot imagine a single person balding being willing to wax their head to stimulate growth to get more hair. Because every person I know that is balding in my world would not put a wax.
No.
Yeah.
They're going to keep whatever's there.
Yeah.
Yeah.
So they're holding on
for as long as possible. Yes.
Yeah,
for sure.
So those are the studies that I think are a good starting conversation. And
it has to be the right candidates and the right situations. I think it'd be great to see like a threading studio, because they'll tend to be the ones getting a lot of those people threading like their chins and their faces, right? How many of your clients come from threading or from waxing? Mm-hmm. Like I would feel horrible having to try to like do this study and knowing that, there's a better thing, but like, let's say some people are not ready for electrolysis just yet. If there was a threading studio or a waxing parlor or something like that was, kind of taking people from like their very first wax and then just tracking the progress, nothing unethical because they're coming in for treatments anyway. They would have done it anyway.
Right.
But like tracking and really seeing what happens, checking underarms, and just tracking density of hair growth, like the pattern, how far it spreads, like we talked about, or underarms, going from your elbow to your hip bone, and it's just all of these things. I feel like it gets worth with time, and that would be a great study. That I think would really elucidate what we're talking about a lot better than plucking rats.
A little bit.
I'm not gonna get over that.
What? We're just gonna come to like our next conference with a bunch of little like mice and be like, we've liberated these guys. Yeah. They no longer have to be plucked.
Little things. No, I feel like plucking animals like with terminal hair is just ridiculous. So that study I think is it's already got, it's, what's the word I'm looking for? I'm tired, but it's got a lot of holes in it. It's not really,
It's not foolproof.
yeah, well, it's got a lot of fallacies, I guess, is I'm looking for a certain word and I can't quite find it. That's just always fun.
It's okay. If
But
it pops up all of a sudden, just yell it out. Well,
yeah. So I definitely think that it's flawed big time, and unfortunately that's also what we've been quoting. Speaking of flawed studies, as I was putting together my talk for the convention, I did a little bit of studies because I wanted to see what studies are surgeons quoting or using to base their criterias on when it comes to gender affirming care, right? And so I kind of started looking at studies and skimming through them. It's always the abstracts because when I used to be, I feel like I want to join the community college again just to have access to their databases, so that I can get the information off of them because it's so expensive. But colleges will tend to pay for like PubMed and all these things. So I get the abstracts, but for the most part, I find these studies and they're comparing, they were grouping electrolysis with the same efficacy as waxing and shaving, saying that laser hair removal was the best method. Okay, Arlene, she can get PubMed, so I'll send you some stuff.
We would love that. It's actually two classes away from being done with my degree.
So you have access to some of those?
I don't yet. I'm not currently enrolled.
Oh, okay.
Because this year was all about focusing on like fine-tuning all the details for Zap Master and making sure.
Sure.
For those on this call, know that Monday is my 20th anniversary as an electrologist. I've been a hair removal expert for 21 years, but Monday is my 20th anniversary. And Friday of next week, I am sitting for my licensing exam. And so I I don't know, like Joanne and I were talking about this. I don't know why I'm nervous. It's like, I know I can do this in my sleep. And like, in the sense of it's like, I live and breathe it, but that test anxiety.
Mm-hmm.
And you guys, I'm an educator with test anxiety. Just understand and wrap your head around that. Right. But I'm taking my licensing exam next week. So
you'll be good.
I'll be good. It's not like I don't teach.
You'll be fine. You'll be fine. Next week we'll talk about how you are you going to find out right away, by the way, or is it going to come in later?
It takes a long time. It takes like a few weeks. So
I guess you can come back and tell us how it went. We can do that.
Our December call, I should have an answer by then when that happened. I'll know right away for my written.
Yeah. Yeah. I don't hate that California, I know that some people are up in arms about how California got rid of the practical, but the practical to me was such a joke. And I didn't like the long waiting period to be able to schedule it. You could only join like once a month and they only tested like 4 electrologists and there's 3 schools in the state. So, if you had a lot of people, I think I had an electrologist or a student that graduated, it took her like 6 months to get on the schedule. And the 6 months is intense. If you leave your job in order to go to school to do all this stuff, like that's crazy.
Want to keep learning on your own time? The Electrology Education Coalition offers a growing library of home study courses covering advanced techniques, ethics, business planning, and more. Earn CEUs, stay sharp, and continue building your skills. Explore the catalog at electrologycoalition.com.
So one of my January girls is driving up, like she graduated last January. She's driving up and taking her test in the same day.
What was the reason why it took so long?
She did say that she delayed to turn in all of her stuff. Yeah. So, like, that's outside of that. But my April person just finished up in September all of their things. So if you think, so they completed school in April.
Yeah, see, that's a long time, I think. I don't think that's right. I mean, I think kind of has a little bit of that too with Maryland, but just because of the multiple boards, I think, because they're a board of nursing and electrology. Well, so you have like a lot of different people overlooking everything you're doing.
They have so much turnover in these like the licensing offices. It's kind of insane, and it's
And
hard.
charities, like, do they give temporary license? No, you can't even do anything. That's the crazy part. You can't even do anything. They don't even do externship. So like if you could hire a student, let's say like a graduate, to do kind of an externship, that'd be great, because then even if it's for a discount, you could at least, I guess your state's not licensed yet, but so they can work. But I mean, it's kind of,
But half my
you just have
students
to
are from
sit on it.
Oregon, and all my Oregon people, it's like they just sit there in limbo. Now, I will say, and I'm super grateful for this, and at some point she'll probably be on one of our calls, but I contacted one of the proctors, Lacey, and she was like, I'm happy to do a day up at the school. Let's book everybody in one day. And so I'm bringing her up here. I'll pay for lunch for the day and all of the stuff. And like, it's just going to be like test, 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 test.
Mhm.
So it's 8 people getting a test in one day, plus like demo and plus lunch. So this is like 10 hours of just one after the other after the other. But what that'll do, and I told this to the state, I said, I know that you guys need proctors. In fact, they have 3 listed at the last time I saw it in Oregon. And of those 3 that are listed, I think a couple of them actually, if I understand the list correctly, are only testing the people that usually work for them. So they're apprenticing and then
That's a
testing.
conflict of interest.
Yeah, it's a little rough on that one. I am not a fan of that setup. But it's not me taking a dig at that. It's just that's the way that
They probably just don't have the manpower, honestly,
right.
to do it any differently. And I mean, I realized this with California. We had 2 testing centers, so Fairfield and Glendale, so north and south. And when I tested like decades ago, they had closed down the Glendale one. I'm in Southern California. Glendale is Southern California. It's LA. And I had to fly to Fairfield, which is Sacramento, me and my model, because you had to bring a model. So I had to fly me and my model. I was 17 years old, rent a car and pay for a hotel, and just to do my test in order to be able to do this. So just logistically, it was a nightmare.
And that's like,
And then they don't test you on anything super valid. I feel like schools tell schools what you expect, and then let the schools handle the hands-on. That's what you should be doing anyway. So set your standards for health and safety, for the types of, the curriculum and everything like that. And schools handle the teaching. And then you can do the board test, the written, just like with every other, like if you come out as a dentist, does the dentistry board make you do dentistry to get your license? Or do you learn that at dentistry school?
right.
So there's some stuff that just kind of doesn't make sense.
Yeah. And like when I was talking to a few of the individuals that are down there, I'm very straightforward. I don't want to ever come across as a conflict of interest and a violation of ethics. Like Eileen, you are so spot on in the comment section. She's like, that's a violation of ethics. That's how it should be done, where you're like having that separation. And I would prefer not to ever exam my own students and have somebody else, like us, swap, right? So I take on your students, I test them, you take on mine, you test them, like something where it's separated. I would love there to be a board of electrologists that this is their whole job, because they are educators that have gotten to a place where they're no longer in a classroom, but they once a month or twice a month host a workshop of practicals. I think that that's a great idea. And I think it's very easily done. I think that it's really frustrating to see that while you're making education accessible, you're making it accessible to a point where you dilute the ethical portion of licensure. And
You make education accessible, but you make licensing inaccessible.
right.
So it's like, yeah, come to school, learn this. It's a great field, but you're going to be sitting in limbo for 6 months.
And they're mad. And I understand that from a student perspective. They're mad when they have made all this investment, got all of their stuff done, and basically they have to go home and practice on themselves to keep themselves proficient up until that point. Yeah, that's hard. There was one other thing that really popped into our heads when we were talking earlier, which as we move forward into setting up the research project, there are some metrics that Joanne and I are kind of like putting together, and like these are things we want to see from it. And I don't want to say what they are to you guys because I want to see what pops into the chat when I say this. I would love to hear from you guys what you would like to see in research in this project as metrics that we're pulling from the data that's coming in from the practitioners. The reason I want to see this is if I tell you what we're planning on our end, it might change your thought process. And I want to see what comes up as things that are important to you as a provider of care or as an educator that you have a hard time talking to the public about electrolysis and its permanency because these things haven't been studied. What does that look like? So in the next few minutes, and I'm more than happy to have people pop on and talk about it as well, but I would love to see it in the chat so we can kind of pull those and see if they're duplicates from what we're planning or if it's stuff that we can add to it, because the more data, the better when it comes to a research project. So that is huge. And even if you're not giving time to the research project because of prior commitments, this is a great way to give a little bit of yourself to the thought process that goes behind this. Because this is not just, I mean, obviously we're the ones leading the charge on this. Electrolysis in charge. That's funny. I am hilarious. We are the ones leading the charge on this study, but we're doing this because we feel that it's very important for our community to have relevant studies pertaining to this. And even
yes, Eileen. So let's go ahead and dump variables. So all the different things that you think we should be pulling from the data that people collect.
yes, like give it to us.
Mm-hmm.
And of what we talked about so far, does anybody want to lead stuff into the chat or unmute themselves and ask questions kind of live right now?
Yeah, with the last 14 minutes or so of today, we can just kind of have it be a little bit informal. I'd like to see if anybody has anything to add.
And then I get on Thursday into the convention in the afternoon. And I'll be at the Silhouette Tone / Zap Master booth in the vendor room. But Giovanni and I are going to be taking an opportunity to put our faces in front of each other as business partners and talk about all of these things outside of just the hours that we steal from the classroom. So anything that you have before Friday or Saturday when we're in front of each other talking about this kind of stuff.
Which is when we do our best work, usually in our face-to-face or Zoom face-to-Zoom face meetings. Yeah. It helps with the procrastination.
I mean, is it procrastination or is it that we took on a lot of stuff and don't know how to compartmentalize as we're moving along?
A little overwhelming, but it's going to happen anyway.
A little razzle-dazzle of both.
That's right.
Yeah.
Let's see. So we've got a couple that came in here. Let me scroll back up. Actually, I'm going to hide the participants. I kind of read through. So I'd like to see average times to finish treatments other than touch-ups. Charity, can you elaborate on what you're talking about, touch-ups versus treatments, so that I understand how you're differentiating the two? I'd also like to see the same statistic with the variable of clients who are not managing PCOS, are managing, so like if they're taking medication or not, and those who are testosterone blockers. Okay. So age, medication, what they've done before, how long they've done it. This is all from Eileen. Modality chosen and why, treatment time to first clearance, total treatment time, insulated versus non-insulated, pictures of skin, hydration. Okay. And then Charity at the bottom. And of course, all of that divided by age groups too. So yeah, we're going to definitely have the basic demographics for most. The treatment specifics, so machine, modality, time spent per area, probe used, number of pulses, time, intensity, any kind of treatment specific data is going to be a must. So I need to be able to like duplicate your settings down to a T, pending I have the same machine. Pictures are going to be a big part of it. So nice, clear pictures. We're still kind of working on the logistics of seeing how we might best want people to take photos of things. I'd like to see differences in siblings. Ooh.
That's actually a great idea.
Go ahead.
On the treatment versus like the touch-up.
Yeah.
So like basically end of like actual, coming in frequently treatment, actually having everything cleared out and like, to the point where I'm only going to see them 3-4 times a year, maybe.
Okay.
If that.
So like when they're going through the treatment plan, pretty much from the clearing to control to maintenance and kind of putting people in those categories of the treatment plan. Mm-hmm.
Yes. Yeah. Kind of end of, before maintenance starts.
Yeah. Okay. And that means we also kind of like, I have a loose definition of what maintenance means to me. That's usually like 15-minute appointments once a month type of deal. I feel like that's maintenance. So we'll have to make sure that we hammer down what exactly that means. And then that way we can split the data and see when are people entering that phase of their treatment plan, So that's the kind of stuff we have to make sure we define.
That we should make sure that we include in there is the terminology needs to be the same across the board. Mm-hmm. So if I say intensity, I'm saying percentage, right? If I say time, I'm saying I need to know if it's by the tenths, the 100ths, the 1000ths, right? Knowing the megahertz, knowing the filament make, the model filament, the like all of those things are already in there. But I think that having like standardized words, because sometimes the thing, I don't know if this gets you guys, but it definitely gets me as a technician. I love utilizing words that are very precise when I'm trying to describe something, because I feel like I get to the point quicker, and that's something I struggle with. But like in our industry, we have needle, probe, and filament. Okay. And that's just like here in the States. I mean, I don't know about abroad, but when we think about that, well, it is a conductor, so a filament makes the most sense, right? And needles, when we talk about
needles, trying to get rid of that terminology.
We're trying to get rid of that because in most places, social media will flag you anyway when you start talking about needles. So trying to get needles out of the conversation. And a probe, while we are probing a follicle, the probe usually doesn't indicate that it's doing something, right? It's an opening of that. So what's that terminology going to be? Or instead, like, and I know that you guys, especially the long-term zappers, if you've gone through any of the textbooks over the years, you'll notice that you'll have one person that wants to call it shortwave, the next person that's calling it flash, the next person that's calling it AC. And so standardizing what we call that across the board. Well, I love that machines have their brand name.
Yeah.
It confuses the public. And so getting to a point where we're clarifying our language so that when we speak as a whole community and not as one person trying to, not that I'm saying anybody on the call is upselling, but upselling based on like the fanciness of your epilator's terminology. It's because it can be that basic. Definitely need to get from our manufacturers the the formulas created to get EL, UL, UE for each type of megahertz. I think that would be a huge help in our industry. And it doesn't always happen because sometimes they're pretty proprietary about that. And I'm like, no, I want to know what you'd call that. So, and how you came up with that preset number. So,
it's like when Eileen added, does lidocaine cream actually dry out follicles? When talking about epilators, we should use that word. And also, if we can make the terms relative as far as settings go.
Yeah, you are.
Coming, Eileen, yeah.
She's like, I'm going to roll. Let's go.
So, yeah, I mean, it's a lot of it is going to be, especially when we get the committee members together and we have kind of our word dump, I mean, which is pretty much what this is corresponding to, is going to be defining terms and putting, our variables together and making sure that when somebody collects, an intensity reading, by the way, like for thermolysis on the Applis machines, it's expressed as a percent, or I don't know about silhouette tone, but like on Instantron, it's expressed as a milliamp. Yeah. So sometimes things don't really translate the same way, so we just kind of also have to see how one might translate to the other. That might be another thing.
Because like on an Instantron, milliamps described in both RF.
Yeah.
And so it's like, wait. Pull back. standardize. So that's some of the stuff that we 100% want to lean into in this study. And then I will see you guys later. Bye.
Bye-bye.
Until next time.
These questions highlight the importance of research in validating our work. Thank you for exploring the science with us.